Can you give me a brief description, a more elaborate description of what you have been doing over the past years?
Well, I guess I have what we say a less than traditional route in terms of certainly health IT. Very quickly, the story isn't. I'm sure it's familiar to many who've done the same thing. I was educated as an MBA, trained, run a Fortune 500 company. Naturally, with that background, I spent about 20 years producing film and television, which is the natural segue into health IT, where I am today, which is almost 20 years now. It's 19 years that I've been involved in this since I came up with this idea that led to my career.
All right, that's interesting. So, was that sarcastic? That film and video production leading into health IT, was that a sarcastic remark?
Actually, it was. You know what? Had you asked me then, I might have been, but no. Now, actually, the reality is the connectivity is my job. Really, as an MBA, I was trained to engage customers. In as a film producer, my job was to engage audiences, and really, what my invention or my communication platform was the whole point of it was engaging patients and providers to communicate better between themselves. So the reality was, I wouldn't have been able to come up with the idea if I did not have the film and television background and looking for
No,
ways to
yeah.
engage.
No, that's surprising because the best entrepreneurs or leaders in any space, they are able to combine two different fields together. And if you're only in healthcare, right? So you only have a unidirectional way of thinking about things. Now, if you have a different background, you can bring all of this together and produce a better product that encompasses a lot of different aspects of what you want to do.
Exactly. In fact, the statistic that's helpful at all is exactly that, which is a read, and I've been trying to get back to the source, where 80% of innovation in any industry comes from outside that industry.
Right. So, how did you see this? Was it difficult for you to combine this? Of course, you had the MBA background and you had the video production background. How did it actually fit into healthcare?
Well, I said one thing, it helped. I was younger and didn't know any better. In part, really where it evolved, I won't bore you for a moment with the details, but I was working on expanding my company to the area of education and training, the film company. And my client was GlaxoSmithKline, and this is around 2005. And we're doing a piece on type 2 diabetes and learning how pervasive it was and how pervasive they anticipated it to be. And really was looking at what solutions were being used then, and they sort of said, well, this is what's being done. I said, well, they're great, but only 18% of people were using these solutions. So, kind of being a card carrying, arrogant producer, I went, well, all you got to do is come up with a way to engage patients to involve themselves in their healthcare, and they'll take better care of themselves. And that was, I figured, okay, I've solved diabetes. Don't have to worry about it anymore. And didn't think about it. And 6 months later, I was actually working a promotional campaign with Motorola for a new cell phone, and this is 2005. And they sort of said, well, sometime in the future, you're going to be able to put programs on telephones and do things like tell the weather. And we said, oh, you're crazy. You can never use a cell phone to tell weather. But literally that evening, I kind of thought about those two things more. And what, well, maybe cell phones are going to be that way to engage people to better manage their diseases. And that started me on my odyssey.
No, that's fairly interesting because you're absolutely right. A lot of these chronic illnesses, it has a lot to do with the individual person, and
Yeah.
we put a lot of burden on the healthcare system as such to improve outcomes. There has to be participation of, by the end user, and that is, if you can't get the end user to actually be involved and be engaged, it's going to be very, very difficult. And I mean, it has led to the obesity epidemic, the diabetes and whatnot, the heart disease, everything that is currently so prevalent. um, and why did you, I think you mentioned it, but why did you choose diabetes? Did you fall into this because it was convenient and you're already working on this?
It was really because of that the continuing medical education piece I did, because it was GlaxoSmithKline and I learned about diabetes. I said, well, okay, maybe it's diabetes is the area to zero in on. I really, literally, I came in there knowing nothing. I was truly, whatever stereotype you want to give for a film producer, that was me when I went into it. I didn't know what this was about, but I learned that the idea came about because of this diabetes project, and that's what I zeroed in on. Now, what I
Right.
certainly subsequently learned how, obviously, how pervasive it was and how truly important it was to be involved with that as the first start. but it was also very helpful because it was most complicated because of the degree of engagement you need to have patients. So I was coming up with this communication platform to help them engage. It was dealing with all the tremendous comorbidity, all kinds of issues that were exceptionally complicated in that population.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Omar Khan. Looking forward to seeing you again. Thank you.